The COVID-19 virus is rapidly spreading.
Europe's open borders are closing.
Much of America shutting down.
Its deadly effects are being felt around the world.
At least 565 people are dead.
One hospital reportedly receiving a new patient every 5 minutes.
And the global economy is crashing.
A financial panic rocked world markets again today.
I think it's clear we're going into a recession.
It's become clear only in the last few days exactly the scale of the challenge that the world now faces with this virus.
Governments are taking unprecedented steps to monitor and contain the highly contagious disease and save lives.
We have to get this problem fixed.
Without drastic measures, it would overwhelm any health system in the world.
But what are the best strategies to prevent the disease from spreading? And what can the world learn from China, Singapore, and South Korea, some of the first countries that were forced to react to this pandemic?
COVID-19 was first detected in China. And despite early reluctance to admit to the outbreak, the country has shown that it is possible to halt the spread of the virus by putting in place extreme measures.
Never in history had a country taken such severe measures and applied them so rigorously and even thuggishly where they felt necessary in order to try and stop the spread of a new disease.
The Chinese government put 60 million people living in Hubei province on lockdown for nearly 2 months, as well as introducing other measures. It appears to have worked. China has had more coronavirus cases than any other country. But following the lockdown, the number of new infections has been falling. It's gone from thousands of new cases per day in February to just a handful of new cases each day in mid-March.
I think that actually it's kind of shown what's possible and set a new norm.
China managed to suppress coronavirus. The latest research from scientists at Imperial College London, a British university, suggests that other countries may benefit from a similarly drastic approach. They predicted how 2 different strategies to fight COVID-19 might pan out in America and in Britain.
One is what they call mitigation, which is to try and lower the intensity of the outbreak at its most extreme in order to cut deaths and to help health services cope with it.
Mitigation focuses on the ill and vulnerable, isolating them at home to try and stop the spread.
Britain has around 8 critical care beds for every 100,000 people. If nothing was done to curb coronavirus, demand for critical care would outstrip capacity by 30 times. The most successful mitigation strategies could flatten the curve dramatically, reducing peak demand by 2/3. But the system would still be overwhelmed 8 times over, and many people would still die.
Researchers from Imperial College say a suppression approach, like that seen in China, would be more likely to save lives.
Suppression, where you try and squash the disease down so that it actually temporarily dies out in the population, and that you need stronger social distancing and you need to sustain it for longer.
Suppression imposes social distancing on whole populations, not just those with symptoms, and may also require school closures for up to 5 months.
Modelling suggests it can keep demand for critical care under maximum capacity, meaning doctors would be able to treat all of the most seriously ill patients, saving lives.
But as soon as these measures are lifted, the virus can quickly return, overwhelming health systems. That's because keeping people away from each other means they don't catch the disease, and so don't develop the immunity that comes with fighting it.
So this is a very sobering assessment. It's obviously a model, but it's the best information we have, and it's the best basis for thinking about the progress of this disease.
All eyes will be on China to see whether it can stop the virus from coming back in a second wave, as it lifts its restrictions. But one thing has already become clear from China. the economic cost of suppression is very high.
If you look at the figures this week coming out of China about the economic consequences, they've been several times worse than most forecasts. Retail sales have gone down 20%. They are expected to go down about 4%. Fixed asset investment has gone down 24%. That's many times more than people are expecting. This presents the world with a real dilemma. It's going to be hard to deal with, and it's going to be even more costly to deal with. And how do you begin to balance and reconcile those two very, very difficult things?
Despite the serious economic consequences, many countries are opting for suppression policies in order to save lives.
A day of sombre language, heralding state interventions unprecedented in modern peacetime.
The advice was clear, a request to the public to do something difficult, disruptive, draconian.
France is just hours away from a nationwide lockdown.
But must measures be as extreme as those taken in China? One Southeast Asian country has, so far, been a role model for how to suppress the virus early.
The number of new cases per day in Singapore has been very low. The country has had fewer than 350 confirmed coronavirus cases in total, far less than would be expected given its close links with China. And so far, no one in the country has died from the virus.
It's done it by very, very clear messaging.
Here in Singapore, we have all along taken COVID-19 with the utmost seriousness.
The advice that Singapore has given its citizens, it was upfront that this was a big threat, that it was going to be difficult, and these are the measures that people need to do.
We have to be mentally prepared for the number of infected cases in Singapore to go up.
Where you see, for instance, I have to say, regrettably in the United States, very mixed messaging, the undermining of officials, the confused, contradictory messages coming out of the White House, that doesn't help.
It may now be too late for many countries to prevent the virus from taking hold. But governments could learn from South Korea, where coronavirus infected more than 800 people per day at its peak.
There was a moment at this when it looked as if South Korea was in real trouble because the disease got away from them. All sorts of cases started popping up unexpectedly.
Yet its government managed to suppress the disease through a national programme of testing, coupled with aggressive case tracking and isolation.
It was highly effective at reducing infection rates.
South Korea had a clear sense of where the disease was, what measures to take. And that has helped it isolate people and to shut down this disease.
South Korea has tested around 310,000 people for coronavirus. Apart from China, other countries have lagged far behind, despite pleas from the World Health Organization.
You cannot fight a fire blindfolded. We have a simple message for all countries: test, test, test.
As the pandemic develops, testing could be key to identifying who is safe to be in public, including those who have already had the virus and who should be in isolation.
The testing is going to have to change in future. The tests that are being used at the moment, which detect fragments of genetic material from the virus in people's bodies, isn't a very good test for those who've recovered from the disease because that material might have disappeared. Instead, you need to look for antibodies to the disease in people's blood. And these are the tests that you need to start doing at a high level. So you can identify the population that is immune.
China, Singapore and South Korea have provided valuable lessons for the rest of the world. They have proved that suppression in the short term can be effective, but until a vaccine is developed, which will take some months at the very least, strict measures will remain in place.
It'll be so demanding and demoralising that I think that society's willingness to go through this again and again and again, which is what the modelling suggests is required if you're going to suppress the disease altogether, I don't think people will tolerate that. Governments have to give people hope and opportunity to be able for lives to return to normal, and they need to find ways to get money to businesses so that they don't all collapse and the economy isn't really severely harmed by the disease. That's a very tall order.
And even with so much uncertainty about the coronavirus, policymakers are going to have to think and act faster than in a long, long time.
Thank you for watching. If you have your own questions about the coronavirus pandemic, then leave them in the comments below. We'll put them to our resident coronavirus experts and publish a film with the answers. Hit the subscribe button to get an alert for when we publish this film, and click the link opposite to get the latest reporting from The Economist on COVID-19 and its global impact.